Living with an inflamed, painful mouth is so miserable for our cats that suffer from stomatitis. It can also be a really challenging disease to treat. But just what is the disease, what causes it, and what are the best treatment options for your cat?
Welcome to the Call the Vet Show, the podcast that helps keep your furry family as healthy as possible so they can live the full and happy life they deserve. And here's your host, veterinarian Dr. Alex Avery.
Welcome to another episode of the Call the Vet Show. I'm really pleased to have you along with me for another fantastic question all about stomatitis in cats. But before I get into that, if you've not listened before, I'm veterinarian Dr. Alex and I'm the vet behind ourpetshealth.com. And my aim on this podcast is simply to answer any questions that you have to equip you with the information that you need to know about so that you can best care for your pet. And as a result, they'll be able to live as healthy and happy and full a life as possible, just like they deserve. So make sure you're subscribed in whichever podcasting app you're listening to this, if that sounds like something you're interested in. If you are a regular listener, welcome back. Really pleased to have you along with me for another week. And I'd love it if you could take a couple of minutes just to leave the show a review over on Apple Podcasts, iTunes, or wherever you're listening to this episode. It helps more than you can imagine with me reaching other people, other pet owners, growing the podcast, which ultimately lets me help more pets live the life that they deserve. So thanks in advance for that. It really means so much to me, and I'll be eternally grateful if you could take just a couple of minutes to do that. But now that's out the way, let's jump into today's question. Today's question was sent in by Paula from the Facebook group Cats Make Me Happy, and she was talking about some of the biggest concerns that her members have over on that group. And she asks, stomatitis is painful and progressive for any cat suffering from this disease. What is the best treatment? Now, I definitely feel the pain of your members here, Paula. It's such a horrible disease to diagnose a cat with, for them to live through, and it can be incredibly frustrating to try and find the best treatment option, with some of the treatments that we'll suggest and I'll discuss in just a minute actually being really quite invasive and seemingly extreme for the problem that's being faced, but they are potentially what is needed. So what are we talking about when we say stomatitis in cats? Well, it's been known by a number of different diseases. The most recent one is feline chronic gingivostomatitis, or FCGS. And actually, it's a really common condition that affects about 0.5% to 4% of cats. So that's a really significant proportion. It's very painful, often debilitatingly so. So cats will stop eating, they'll dribble, and I'll discuss other symptoms in just a minute. But it's a chronic long-term condition that they have to live with that results in really severe inflammation and ulceration of the mucosa of the gingiva within the mouth. And the symptoms and signs of stomatitis in cats are a reluctance to eat. So your cat might go up to their food bowl but then not eat simply because they're so painful. You might notice that they've got really bad breath, and that can really be horrendous sometimes. They might be dribbling as well simply because it's so sore to swallow. When you look in their mouth, you'll see a gingivitis, maybe a hyperplasia, which is an overgrowth of the tissues of the gum. There'll be ulceration, there might be missing teeth, there might be feline oral resorptive lesions or feline odontoclastic resorptive lesions, which is basically where the teeth become moth-eaten, and you might notice pink spots, especially around the gum line of your cat's teeth. And then if we take x-rays of these guys, we can see an awful lot more problems in a number of cases, actually below that gum line, with the roots being resorbed, fractured teeth and missing teeth. One of the big problems with treating stomatitis in cats is that we don't actually know exactly what causes the problem. There have been a number of different diseases and conditions that have been proposed, and that includes bacterial infections, viral infections with conditions like feline leukemia virus, feline immunodeficiency virus, herpes virus and calicivirus. So those are our two main cat flu viruses. Fractured teeth can also cause it with exposure of the pulp. Resorptive lesions, like I've mentioned, incomplete extraction or retention of tooth roots can also potentially cause this problem. Other diseases might be involved, so kidney disease, liver disease, and underactive thyroid, diabetes, high blood pressure have also been proposed as potential causative factors. Allergies as well is another common thought that's behind this. So that could be food, flea, or environmental allergies. And then the final thought is that it could be an immune problem. So an immune-mediated or autoimmune disease where the body's immune system is effectively attacking its own tissues. The simple fact is we don't know exactly what's behind it. It could be a combination of a number of these different potential causes. And one other condition worth mentioning is cancer. So depending on what things look like, it could be that actually rather than a stomatitis, this chronic gingivostomatitis, you could be dealing with an oral tumour. Diagnosing a cat as suffering from stomatitis involves a number of different tests. In the first case, a simple physical exam is going to highlight the fact that your cat might be suffering from this disease. Blood tests might be taken, which look at just the general body health, organ function, kidney disease, liver disease, but also for viruses. So our feline immunodeficiency virus, our FIV, and our leukemia virus, our FELV. Thyroid levels might also be checked just to check that your cat isn't underactive. It's not very common in cats, but it definitely might be a consideration and an underlying cause, like we've already mentioned. Swabs might be taken to look for signs of these flu viruses, so our herpes virus and our Callice virus. A full dental examination is then going to need to be carried out. That needs to be done under an anaesthetic. There's no way that a cat, even a healthy cat, is going to tolerate their mouth and their teeth being poked and prodded. But remember, these guys, their mouths are incredibly painful, so they have to be under an anaesthetic for us to really visualize what's going on. And then dental x-rays are really important if your vet's got the availability. If they don't, it might be a consideration to actually refer them to a practice, a dentist that does have that facility, because that can show so many problems hidden underneath the gum line that we can't see without x-rays. And then finally, if there's any thought that there could be something like a cancer going on, a biopsy is going to be taken. That's going to be analysed by a pathologist to determine whether your cat does have chronic gingivostomatitis or whether they're suffering from a tumour. And then moving on to cat stomatitis treatment. Now, unfortunately, as you may have already guessed, because we don't know the exact cause and because the disease can vary so much, the treatment options are numerous and there is no one size fits all that's guaranteed to help every single cat. This means that there are a number of different potential treatment options that your vet might need to work through to best find the solution for your individual cat. The first option really is to extract any obvious teeth that are causing problems. So any that have got pocketing, that have got resorptive lesions, or that are fractured. Even if they're not causing the stomatitis, they are going to be painful and your cat is going to be so much happier with those teeth removed. Once that's done, the remaining teeth are all cleaned up, then giving antibiotics, painkillers, and ongoing oral care is really vital. So meticulous oral hygiene is going to be needed. And that can involve toothbrushing, a dental-friendly diet, chlorhexidine, antiseptic oral rinses. So think of those as like a mouthwash for your cat. And then oral gels that really help reduce the bacterial load in the mouth and optimize oral health. Can help to reduce the severity and even eliminate stomatitis, especially if we're dealing with a mild case of this disease. Cat stomatitis treatment option number 2 to consider, which is normally carried out if those problem teeth being addressed has not solved the problem, is to try a number of different husbandry and medical treatments. So the first thing to try might be a novel protein source food. So effectively trying an elimination diet. If there's any food sensitivity, food allergies, then that really is going to help. Trying immunosuppressive drugs, so something like cyclosporin or prednisolone, can really help if there is an immune component to the disease. And often that does help, certainly in the early stages of things. Whether it's enough to completely eliminate the disease is another story, and often that's not the case, or certainly if it is to start with, then the disease becomes uncontrolled. Giving pain relief, different forms of pain relief, so that could be a non-steroidal anti-inflammatory drug like Metacam or Meloxicam, We can't give that when we're giving a steroid. Or buprenorphine is another option, which is an opioid analgesic. So it's a very strong painkiller. And then other treatments, something like interferon has also been trialled, which is another way that we can try and modulate the body's immune response to reduce the inflammation and the attack on the body's tissues. Now, unfortunately, even if all of these options do help in the first stages, as a cat gets older and they're living with this disease for longer, there's often a breakdown with things getting worse and deteriorating again. Equally, for those cats that are really seriously affected, often these first two treatment options simply aren't enough to control the disease and make those cats as comfortable as they could be. And that leads us to perform some more radical dental surgery. And that can either be in the case of a partial mouth extraction, so that's extracting all of the teeth behind the canines, so the molars and the premolars, or having a full mouth extraction, which is removing every single tooth. Now, while that might sound extreme, remember that the implications and the effects of this disease on a cat's well-being are huge, and often removing the teeth actually has a really huge benefit for that individual. They are actually able to eat fine. All of that inflammation will settle down. We can give wet food or we can soak biscuits, so cats are able to eat absolutely fine. There's no problems there. Our cats aren't relying on hunting and catching and killing their food, so they don't need their teeth. They're kind of optional extras, if you like. It is important that if your cat does have full mouth extraction, that really it's performed in a location that does have dental x-rays. Sometimes these cats, their teeth can be very brittle and it's quite easy to fracture them and leave a small tip that would only be apparent if an x-ray is taken. And it could be that that single retained tooth root is enough to stimulate the disease and stop it from resolving. So I hope that gives you some ideas, Paula, and everybody else, about how we can best go about treating these cats with stomatitis. It really is horrible, and my heart does sink whenever I see this in the veterinary clinic. But there are options that we can do. It's just a process that we sometimes need to work through, and we need to accept that these more seemingly extreme treatment options are best for these cats. So I hope you all found that helpful. I'd love it if you could share this episode with 3 of your cat owning friends or family to help me grow the podcast and reach more pet owners. But until next time, I'm veterinarian Dr. Alex. This is the Call the Vet Show. Take care.
Thanks for listening to Call the Vet. For full show notes and any links mentioned in today's show, head over to callthevet.org, where you can also submit your question to be featured on an upcoming episode. We'll see you next time.